Hello people. So deformities or exostosis in the back of our foot, in the heel of the foot, are actually very common problems in the population, and they are not something that will kill someone, but they are problems that will ruin the quality of life of a person, because most of the time, every day, there is pain, and this pain, when it is felt over months and years, it will ruin someone's quality of life, especially if it is severe. So the Haglunds deformity is actually an exostosis. So it is basically a bony prominence, like this, that arises in this posterior and superior part of the calcaneus. So this is the calcaneus, and in this posterior superior part we have this bony prominence that arises, and this bony prominence is actually this what is called the Haglund's deformity. It is also called in medical terms a retrocalcaneal exostosis. Retrocalcaneal exostosis. Okay, so this bony prominence, when it is large enough, it will actually, when we walk every day, after days and months, it is rubbing against these soft tissues present here. It is rubbing against the tendon sheet of the Achilles tendon. So this is the Achilles tendon, and it will rub against the tendon sheets, against the bursas. So here is the retrocalcaneal bursa, and there are bursas around this tendon, and it will rub against all of these soft tissues, and that will, of course, this constant irritation will lead to an inflammation of this region, and then the patient will feel pain. Often, so the pain in this region, pain in the posterior heel, is the presenting feature of this disease. Pain in the posterior heel is the presenting feature of the problem. Also, some thickening of the skin and the bump in this anatomical region will be present if the disease is developing over some time. Also, we can see swelling, redness, warmth, and other symptoms. But for this bony exostosis, only in the acute phase, so when we have inflammation, we will see more swelling, redness, warmth, tenderness. But when there is when the bursas are not in a significant inflammatory state, and when only the problem is the pressure of this bony exostosis, the marked feature is actually this pain, and this is the biggest problem of the patients. Even if we see the region, we can see a little bump. If it is chronic, we will not see much swelling or even none, and no redness. But if we push here, there will be marked pain on palpation. So In order to diagnose this is fairly easily diagnosed as Haglund's deformity. So the story of the patient, of the pain in the back of the foot, then the clinical examination, and then with an X-ray, so a lateral X-ray, and maybe an ultrasound, we can definitely see, is there a bony spur, what condition is the Achilles tendon. It is also possible that with this spur we have some tendinopathy. So this is the Achilles tendon, and we see that the insertion point is changed. So it is a tendinopathy, a calcification of the tendon. And most of the time we have also bursitis of the bursas, the retrocalcaneal bursa and the subcutaneous bursa around the tendon. And if we have all those changes, so if we have an exostosis, a retrocalcaneal exostosis with bursa inflammation and involvement and the changes in the tendon, then all of this is actually called Haglund's syndrome. But only the exostosis, the retrocalcaneal exostosis, is also called a Haglund's deformity. So Haglund's deformity. Once we establish the diagnosis, so the therapy is like all of these pathologies, all of these bony exostosis in this part. The therapy first is conservative therapy. That means we try, especially that means when there is inflammation, we will try anti-inflammatory drugs. We will try heel pads, then ice packs for cooling, and rest in the acute phase. Once the inflammation is down, we can also do physiotherapy. So physiotherapy, various stretching exercises and so on. All of this together can help many patients, and is a conservative therapy. If the patient is not satisfied with this therapy and he still, after many sessions, has pain problems and it is ruining his quality of life, then we can think about a surgical option. So there are many possibilities. There are mini-invasive surgeries that make a small incision beside the Achilles tendon and take this bony prominence apart and remove it, and they can also remove the calcifications of the Achilles tendon. There are also some other bony prominences in these regions. There is also a calcaneal spur, not to diffuse with this spur, the Haglund's deformity. So the Haglund's deformity is a spur that is present in the posterior superior part of the calcaneus. But there is also the calcaneal spur, and the calcaneal spur is actually present in this posterior inferior part of the calcaneus, and it is connected with the plantar fascia. And people say that actually this spur has a lot to do with plantar fasciitis. So this is a totally different disease, but all of these problems can, of course, arise together, and we can find them together. And the therapy is similar. Also, a possibility that is much more done in this case is corticosteroid injections, But in this case, we need to be very careful because giving injections of corticosteroid here can possibility land in the Achilles tendon, and there is a risk of rupture in those cases. So basically, on some very frequent conditions that we see in patients that can make problems because they can get very painful. Thank you.